welcome back to another episode at Le Bump Edit, this space where we talk about everything motherhood, womanhood, and everything in between. I'm your host, Valerie, owner and CEO of Le Bump Palm Beach, and today's episode is one that hits very close to home for very many moms, and it's something that we don't talk about enough. We're diving into maternal mental health. What is it? How does it show up? Why recognizing the early signs can literally change your life. And if you're a loved one that is watching someone go through similar things, how you can support these loved ones. I'm honored to be here joined by Sowania, a licensed mental health counselor who specializes in supporting women through the emotional journey of motherhood. You also have a special certification. Can you remind me of what that is?
I have a PMHC, so that stands for Perinatal Mental Health Certification. I was certified through Postpartum Support International. We have over 7,000 certified providers internationally across the world. And if you're looking for a provider that specializes in that, I would strongly recommend checking out their website. They have a directory with thousands of providers, like I said, across the globe.
Yeah. Nice. So welcome to the show. I'd like to introduce Sowania. She's just in the same passion as we are here, and everyone that comes to Le Bump Edit is to help mothers. So welcome. Thank you so much for joining us today.
Thank you.
You are going to be talking to us about red flags, warning signs of maternal mental health issues, the need for a strong support system, how relationship dynamics shift after baby arrives, and why PMADs, or perinatal mood and anxiety disorders, are the #1 complication of childbirth. So whether you're a mom or a partner or someone that is just wants to better support that loved one, this conversation is definitely for you. So thank you so much for joining us. So to start us off, what are some of the most overlooked signs a new mom might be struggling with in mental health?
Definitely. So sometimes people misconstrue baby blues with postpartum anxiety and depression. Postpartum, the baby blues can occur for up to 2 weeks, which is normal, 14 days. And what that could look like is crying spells, not feeling like you're yourself, not able to focus, not feeling like your skin. Your postpartum is pretty normal with that. Like I said, crying spells, not feeling yourself, poor sleep habits, not having the urge or the desire to eat much, not really able to bond with the baby. Those are some signs within the first 14 days. If that goes beyond the 14 days, then that's not baby blues. That is something to definitely look out for. So it could be postpartum depression, anxiety, it could be psychosis, which looks totally different from that. Trauma, so birth trauma could look like postpartum depression and anxiety. With postpartum depression, it could be an inability beyond the 14 days, an inability to get themselves dressed, not really, like I said, bonding with the baby, not excited, not feeling like doing the things that they normally like to do, crying spells, not wanting to have family over, isolating themselves in their home or in their room, not having the urge or having difficulty with nursing their baby. That's with the postpartum anxiety specifically. Having intrusive thoughts, that could be one. And some intrusive thoughts that may pop up: is my baby gonna fall down the stairs? Is my baby gonna smash their head? Is my baby having a poor time sleeping? Watching the baby going in the room, constantly looking at the baby in his sleep, or looking at the outlets that they have, monitors that assess the baby's sleep they're feeding, which kind of drives anxiety even more when someone's experiencing postpartum anxiety. So that's something I talk about with my moms individually. Hey, is this helping our anxiety, or is this contributing to it even more? So those are some of the signs to watch out for. And when you're in it, you don't see it. That's why it's important that your partner or your loved ones to be on the lookout to know what these signs may look like.
Yeah, that's so powerful. I'm so happy that you shared all those different methods of having it. I remember after I had my little one, I did experience a little bit of that. And so it's interesting. Thankfully, it didn't develop into anything more, but all of that can be overlooked. Yes. You could just think, oh, this is just normal, especially if you're a first-time mom.
Yes.
Oh, she's just obsessed with her. Loved ones can confuse it. Oh, she's just obsessed with her baby.
Yeah.
Intrusive thoughts. That was a big one for me. I was like, why am I thinking these things? I used to think that someone would come in and steal my baby. I didn't want my baby to go anywhere. If someone had my baby, I I don't know, even if it was somebody that I loved, I was very much, no, give them back to me because you're not holding them properly. It was a lot of anxiety. I don't know how I navigated through it. I just did. But sometimes that could be difficult to get through, right?
Yes, definitely. You pointed out some other definitely key points, right? They're feeding, who's holding the baby, how much feedings they're getting, measuring.
I was like, no one's going to do it like me.
Yes, yeah. Because
and I was so stressed. And I should have been taking the opportunity of, okay, they're going to take care of my baby. Let me go take a shower.
Right.
Because I need a shower and let me give myself time, and I didn't want to. It was like just all about the baby. And it stressed me out. I realized, and some family members did tell me, like, Valerie, take the time. Your baby's going to be fine. Go shower. And then I started slowly doing things for me, and it could have developed into something more.
Oh, of course.
Yeah, so it doesn't always look like tears. Oh, she's not in the corner crying, that she's depressed or anything like that. It could just be signs like that can be missed.
Yes, and more than likely in my practice, I see more postpartum anxiety than anything in birth trauma. Not so much postpartum depression, especially since COVID.
Yeah. I can't imagine when the COVID brought so much anxiety.
Yes.
Especially now that we're so much more aware of like germs and stuff.
Of course.
Germs have a totally different meaning to a lot of moms after COVID.
Because anxiety initially, it's essentially our fear of not having control. So you imagine postpartum anxiety is not having control of that fear of not being able to control your baby's environment or who's holding the baby. And if I'm controlling my baby this way, then the baby's okay and everything, the world is okay, and that's that. But realistically, it's not healthy for you, it's not healthy for baby. And PMADs, and we'll get into that, the number one complication for new moms.
Yeah. So real quickly, let's talk about the support system, because this is definitely something I know without the support system that I had, who knows what that would have looked like from it would have developed into something a little more serious. We always hear the saying, it takes a village, right? Yes. Especially when it comes to motherhood. But what does effective support actually look like when it comes to maternal mental health?
Effective support may not look like a village and for everybody, like a large village, right? It could look like having an emotional village, having a therapist, having a psych NP or your doula or your OB. It could look like having a mom group. It could look like having a partner who hears what you're saying and that you're working together as a team effectively, caring for this baby essentially. It could look like asking you for do you need rest? Do you need time to be alone while someone else takes the baby instead of you feeding the baby every hour? So hearing your feelings, hearing you out versus, because when a baby's birth, a mom is also born as well. So it's not just about, we take all this time in the beginning, right, when they're pregnant, the baby shower and the baby, but you were also born, right? A new woman is now in this planet. You're a mom now. So effective support looks like all of the above and some, making sure that you are not that person, but also who you are now. Remembering that, like, you love to work out before you had the baby. Okay, what could workouts look like afterwards, after the baby? Maybe asking your support system. It could be small, it doesn't have to be this large village, but some form of support is needed for you to be effective as a mom and be healthy. So it could be emotional, physical, and spiritual. It could be like a spiritual space that you have, something that you believe outside of yourself, and a support system within that, I think is very important.
Yeah, you answered my next question, because there's a lot of moms that sometimes have to tackle it alone. The baby daddy is not present, and sometimes maybe they live in a state or a place where they don't have family so close, or even sometimes those loved ones or family members don't want to be involved. So what can that look like? And just trying to remember the activities that brought them joy before, try and do that. Mom groups, finding people that are going through the same thing and you can support each other. That's super helpful.
I could definitely empathize as a mom of 3 myself and not having the support, and I'm living far from family. Definitely what I recommend and what the research shows. The research shows there's plenty of free mom support groups, even online or locally. I know the Peanut app was a good app that I used back in the days when I had my first, and even local mom Facebook groups. Finding your people that relate to you, that share the same values, and that you have, right? Because the way you parent could be different from other moms. So making sure you're just interviewing your mom group and that village. And there's a lot of fourth trimester groups. Our practice runs postpartum groups as well for new moms, and they develop like a little chat where they check in. Hey, during COVID, I had a fourth trimester group I was even a part of while even practicing. And those moms during COVID were sending me formula from Germany and France, because I was like, oh, I don't want to give this formula, and we're packaging out and sending it to me during COVID.
So it was like the pre-gaming.
Yes.
For what was to come.
Yes. And they were so supportive,
smart.
so thankful. And I gave birth in June 2020, but I met all those moms would spend. I was like, no, I'll send money to ship it. Nope, don't worry. Like that's a village, right? Like the moms knowing each other. Yes, yeah.
That is for sure a village. Wow. Now let's shift it a little bit to relationships. Having a baby can definitely change the dynamics between partners, right? Emotionally, physically, financially, these tiny little things. It's amazing how much stuff they need just to make it smoother process. What are some common changes that you see with couples and postpartum?
So some common changes I see is communication, like concerns around communicating the mom's needs to their partner, or in heterosexual couples, seeing that, feeling like the load is there. Mom load is something that's been, that vocabulary, that language has come up a lot, not being, their feeling being heard, whether it's the load of all the tasks that need to be done from the home, the household, with the baby, or even just like responsibilities or expectations externally from their culture, their extended family, making sure managing the budget or the bills or daycare, childcare, interviewing schools, all these things. And sometimes the partner's like, what? Some partners I'll see 75% of the time, they're like, we got to interview schools, we got to do this, they got on a wait list. Yes, these days, if you want to get into a good school, yes, we got to. So this load is a lot for moms, and making like feeding the baby, nursing or not, picking the right doctors, pediatricians.
So many things that you have to do research on.
Yes. And the moms are expressing they're feeling alone, they're feeling not heard, or sometimes their spouse may have neurodivergent. I see that a lot, or not able to. They'll give their partner tasks and they're not able to focus on them, or they're not able to complete the tasks and get them done, or they don't know. They're like, I don't know if I could stay in this relationship much longer, Sowania. I don't know if I could do this. I feel like I'm alone with several kids. So I see that a lot. And it depends on the arrangement, right? Each couple is different. So I would recommend, if you're pregnant, to talk to your partner about, what is this arrangement gonna look like when we have this baby? What are the expectations? Who is gonna be running this? Who's gonna be managing this? A household is like a business. Managing a family is like running a business. So I recommend having family meetings about your finances, about these tasks that are happening in the household, so you don't feel so isolated and alone.
Checkpoint.
Yes.
That's really good. How about couples that have proactively protected their connection and mental health during this transition? How can they do that? So you mentioned doing these checkpoints. What else can they do? What I've seen benefit, and the research shows, is couples therapy. Like, I offer postpartum prenatal intensives, and what that looks like is that we're having a couple of sessions, say 2 sessions, 3 sessions, and we're talking about what I just discussed, like a birth plan, a postpartum plan, a checklist. We're going over what the household is going to look like, who's going to be allowed to come in the house postpartum, or in the hospital postpartum. What are the meal plans? Who is going to be meal prep there? Who's going to be doing sleep train? Are we going to sleep train the baby? Who's going to be how are we going to emotionally support each other? Because each individual has their own love language. How does that look like when we're showing up for one another? So I talk about that in those couple sessions, and literally I'll just have one check-in after, and they're like, Sowania, we're good. We're good. Yeah. And literally it flows like everything, because everything's been in place beforehand, and it works out, and they're able, and I'll now check in with them like a few months later, how's everything going? They're like, I'm so thankful. Like, we reviewed everything that could happen. And this is not just first time parents, it could be second time parents, multiples, because that shifts the family dynamic as well. You know what I mean? So I've seen it strongly benefited
couples because they're able to be more cognizant and aware and have more empathy for one another and show up for one another when they have keywords, hey, to check in with each other when they know that they're needing extra support or they're needing
I like the keywords because sometimes you're feeling so many emotions and you don't even have that many words to say. One key word says everything for that partner. So pre-gaming with your support system, and I guess pre-gaming or preparing with your partner before baby is here, having that postpartum plan.
Yes.
And then as far as when the baby's here and the relationship dynamic is happening, the checkpoints.
Yes. Yeah.
Good. I love that. I want to shine a little bit of light on something that has not been talked about enough, and it was Maternal Mental Health Awareness Month last month, correct?
Yes.
So PMADS, and that stands for Perinatal Mood and Anxiety Disorder. You said before that it's the number one complication of childbirth. Can you help us to understand exactly what those words mean? What does that look like?
Yeah. So, pause.
Yeah. That's
all the facts here.
Oh, we do have the same phone call.
Yes, that's what I said. I was like, oh my God. Hold on.
No worries.
I want to make sure I give the right facts.
Yes, girl.
Hold on. It's starting.
And you could keep your phone out if you need.
Oh.
I have a whole clipboard.
Oh my gosh, you're so funny. Okay, here.
Do you want me to ask I can ask the question again so that way we can connect it?
Yep, perfect. I got it.
So I really want to shine a light on something that hasn't been talked about very much or enough, and it's PMADS, Perinatal Mood and Anxiety Disorder. You've mentioned in the past that this is like the number one leading complication of childbirth. Can you help us to understand what that means?
PMADS stands for Perinatal Mood and Anxiety Disorder. So under that umbrella, there's postpartum anxiety, postpartum OCD, postpartum psychosis, perinatal anxiety or depression, birth trauma. So all of that falls under that whole umbrella. 1 in 5 women experience perinatal mood and anxiety disorder, PMADS. That's what the acronym stands for. So what that may look like is if you have a history of anxiety, if you have a history of depression, if you have a history of trauma that has been left untreated prior to getting pregnant, you're more than likely to have one of those, the PMADS. And that could definitely impact your baby, and you're more than likely to go, the research shows that you're more than likely to go into preterm labor. Your baby is more likely to have a mental health condition. You're more than likely to have complications while giving birth, or your baby going into the NICU, having low birth weight. So those are the statistics around that. So if it left untreated. So that's why it's really important to get treatment. What treatment looks like is therapy.
And we're talking about treatment like pre-existing.
Correct. Pre-existing of the depression and anxiety. Yeah.
And it trickling into
Correct.
the postpartum. And
Correct.
That's crazy. It's almost like a domino effect, how our bodies just feel that anxiety or those different mental health issues, and it just reflects on our bodies and can even affect our unborn child.
Yes, definitely.
Wow.
Yeah.
That's very shocking. That's something so common and still so undiagnosed.
Right. And I want to add to that, the postpartum period is a vulnerable time because there are hormonal shifts, there's a lack of sleep, and the isolation amplifies the underlying issues, the underlying untreated conditions that were there. So that's the big piece that really just ramps it up. So that's why I said what I see best case scenarios is women who come to me, like I've seen them, or my colleagues who get treated, they are in therapy already, they're getting treatment, they're working through their mental health conditions, and then they want them pregnant, and they're like, hey, and an EMDR are great modalities, which I also provide if you've experienced trauma or birth trauma, but they're getting treatment and then therapy, they're getting medication management, or they're managing their hormones with an integrative doctor. Everyone's case by case is different. And then postpartum, like I said, they're getting that support throughout the pregnancy. They're going to the therapy groups. They're getting that. They're having their systems in place, and they're likely good. Because they're getting treatment. Right. Versus not getting treatment, there's a host of other risks.
So if you're a mom can relate to that, having these pre-existing things, this is definitely something you want to look into and pre-game or prepare before baby is here. That way you don't have these different issues later on. So what can providers and loved ones do to help screen for someone going through this?
Yeah, so there is a screening tool that your OB usually provides at your 4 week
Like a
or 6 week.
questionnaire?
Yes, yeah. And it's the postnatal Edinburgh scale. That's the clinical term for it. But your pediatrician should be administering this for every checkup within the first year for your baby.
I think I've only received it once.
It's supposed to be the whole, that's what the
And
research
it's
shows.
like a lengthy,
CDC recommends the whole first year.
important.
Yep.
Make sure you're getting that questionnaire.
Yep, your therapist, if they're trained in this specialty, I administer it the first 6 weeks, and then I'm doing it like clockwork.
And be
Every
honest
part.
with it when you're
Yes.
filling it out. Don't feel like, oh my gosh, it's asking me if I have these intrusive thoughts or if I'm sad when I hold my baby. Answer the question properly to make sure, because that's going to benefit you and your baby. Because that could make you feel like you're on the spot. Oh my gosh, I don't want to be judged. I don't want the doctor to get this and be like, or what if your questionnaires, everything was good, and then all of a sudden there's a switch? That can happen too, right?
Yes, it can happen. You can have later onset diagnosis of PMADs. It may not come on so quickly early on postpartum. It could be later on. I've had moms that come 6 months later.
Interesting.
Everything was fine in the beginning, and then my husband went back to work after 6 months, and my family's not there anymore, and I didn't have to treat it because I had the support. But now I'm having to treat it because they haven't had the support. It's more prominent. It's more seen. So I have seen that many times as well. And to go back to what you were saying before, not just pediatricians we recommend, but doulas, midwives, OBGYNs, perinatal therapists, pelvic floor therapists.
I'm going to even start asking
Kairos.
my patients
Yes.
here, hey, how are you doing? I usually do. I love, everyone that comes here knows that I love to chat.
Yeah.
Especially like, how are you doing? Because
Yes.
everything's always about the baby. So yeah, every practitioner, everybody that comes in through your practice, you should be asking these
Yes.
moms.
That's what the research shows. It's best practice. CDC recommends it. Does it happen? No. I hear more what you're saying. Like, didn't receive that.
No, I know for sure I got it once. And I want to say baby was big already. Baby had to be, it was like his 8 or 9 month
Wow.
checkup.
Yeah.
I'm wondering, which it's probably still not best practice, I'm wondering if it's because in the very beginning, because I do remember I got it at the hospital. I got it when I got checked at the gynecologist after, like, for my own checkup. I'm wondering if somehow those things are connected and it hasn't been an issue, so they just, oh, she's good, we don't need to give it to her. But that's still wrong. Don't assume, right?
Yes.
You should still give it to your patients, because there's what is that depression called, where you're just always all smiles, but in reality you're depressed.
Depression.
Okay.
Yeah.
Because there's times where you see people that are like, oh my gosh, they're not depressed. They're so happy. They're always, when maybe at home they are.
Yes.
Yeah.
Some people are able to mask it better than others. And there's also bipolar disorder, maybe that like where you have highs and then lows. That's a mood disorder as well. And I've seen that where people weren't diagnosed with that before they were pregnant, and then after they give birth, they've been diagnosed with that, but they didn't realize it. They're just when they were adolescents and they got their period, they just it's just hormones.
And so usually, say a mom notices fairly quick, she's at that 1 month and she's aware of these things that we've talked about, and I need to come and see you. Obviously, I'm sure treatment plans and the length of treatment probably changes, but on average, what does a treatment plan look like? Yeah,
so usually when a client reaches out to me, I schedule a consult with them, a free consult, and we talk about what they're needing to work on and how I can best support their needs. And then from there, we talk about, from what they're discussing, hey, let's book an intake, an assessment. We go over their family history so I can understand their medical history. I'm asking them who's involved. I get a release to coordinate care because I like to have all hands on deck. And then from there, treatment usually lasts around 4 to 6 months. And then I'm making sure, hey, I'm providing clinical recommendations. Hey, based on what you're saying and my experience, this is what I've seen work. What do you think? And I look at everything, like I said, their family history, their culture, where they live, the supports they have, holistically. I have like a holistic approach, right? One size doesn't fit all for everybody. So I take that very much into account So yeah, some of my moms, they're there longer. And those are the clients who have had a significant history of trauma. They've been with me. I have clients I've had with me for over a year and a half, but they've had multiple babies while they saw me. So they were pregnant, they delivered, and then they wound up getting pregnant again, and they wanted to make sure they had that support with their
I'm
partner.
glad you mentioned that. Have you noticed any increase in moms that have had multiple babies go through this? Is it mostly first-time moms? Does it stay if a first-time mom did go through this, and does it come back with next baby?
So usually the research shows, and what I've seen in my experience, if it goes untreated the first time, it's never been treated. It's like saying it's still there. So people think, okay, like I don't have to treat it and it'll go away. And also too, postpartum could go beyond the first year, beyond the 6 to 8 weeks. So some people have a perception, I don't have postpartum anymore, so it's not technically I'm reaching out for you for postpartum. But us as the clinical providers, if we know that you had a baby within the last year or two and it went untreated, technically it was just not treated. So back to your question about, what was the question you asked?
Yeah, the question, if there's multiple pregnancies, does that make...
So I've seen with multiple pregnancies where, yes, if in a short span of time. Yes.
And it could cause that.
Yes, because at least you have more
anxiety.
time. Yes, I have moms who have 4 kids, and they have 4 kids within a span of 5 years.
Yeah,
and
that is a lot.
The lot.
You're trying to take care of the little ones that are here, the new one, yourself, husband, everything in your environment.
Yes. So what I'm working with them is like slowing down, utilizing a lot of mindfulness, grounding techniques. Like I'm not rushing to go on meds, but I'm helping them to teach them tools. Like what are things that we could slow down right now.
Let's calm your central nervous system.
Yes.
Let's get you
grounded.
Down.
And I'm modeling that for them in session. I'm doing it with them collaboratively in session. So that's what the focus is within our sessions and the beginning. And what are some things I'm analyzing, asking them about their family dynamic, the routine, what that looks like, and identifying certain things that we could shift, minimal shifts, slowly glitching.
Yeah.
Then after a month, the clients are starting to feel, and I administer other scales to them as well to assess every time they see me. Is their anxiety lowering? Is it the same? And after that, I'm like, hey, this is my recommendation. What I'm hearing this, what I'm hearing that. What is support? Where more supports we could have? Hey, and sometimes people need medication. You know what I mean? And then I could ask them, hey, we could talk to your OB. Your OB is the best person to start with because that postpartum period to go to with that.
And then at that point, you can write a letter to the OB or speak to the OB. And
yes.
let them know, hey, this is what we're doing.
Correct. I get a release.
Prescribe.
Yes. Yeah.
How about mothers that have had postpartum depression or any one of the anxiety disorders with their first? How likely are they to experience that with their second, third, or fourth?
If it goes untreated, they're more likely 100% to experience it the second, third, or fourth time. Treated, less than likely half.
Okay.
Yeah. So like I've had many moms, like I said, who have multiples and they stayed with me throughout the second and they were fine. Like, and they were able to, okay, so I'm good.
They could probably better identify it.
Yes.
They can put into play what they learned with you.
Yes, they gained coping skills. They've created systems. They're on medication. So like I said, or they've checked out their hormones. So a lot of moms have been recently diagnosed with Hashimoto's. So the providers that I work with, they're doing full blood panels. They're checking to evaluate everything. And once again,
sometimes it could be your thyroid and it's just out of whack. Your hormones play a role. Hormones play a huge role.
Yes.
When it comes to how we feel in our anxiety.
Yes.
Wow.
Yeah.
Well, I love that. Is there anything else you want to add that I didn't ask?
Just that there is hope, that you're not alone, that there are supports out there. Definitely check out my website, SowaniaJermainLMHC.com. We're accepting new patients for couples and individual, and we're here to support you. We're currently running a birth trauma group, and we have openings. It's ending in July. But
and you're in Wellington.
Yes.
Your practice.
Yes, I do in person upon request and virtual as well. I'm licensed in New York and Florida. And in the fall, I'll be able to see more clients in other states as well. And that there's hope. You're not alone.
Yes.
And there are plenty of providers, great providers out there that are certified and trained that can
make sure to
support
do your
needs.
research on the training that you just told me. That's 3,000 hours. Can you tell us a little bit about
Yes.
the training? Very important for you to look into for your therapist.
Yes. So if you're looking for a therapist that specializes in PMADs, go on Postpartum Support International Directory. And we've had plenty of hours, up to 3,000 hours that we've done. We sat down for training. It shows that, hey, we've worked with moms and we know what medication, what modalities, what work for you. You know what I mean? So that's what the training is that we've done. The hours and hours of training. We know how to identify birth trauma. We know how to identify postpartum anxiety, depression. We've done the research. We do the trainings every year. We do CEUs for this. We have to get recertified every 2 to 3 years in this. So definitely.
It's not a one size fits all.
No.
Not every therapist is trained to
Yes.
treat everything.
Nope. So even I have a therapist friend of mine who is a PhD. Like I'm in a group of like 100 of us, and and one of them was like, she's a mom, and she was like, my therapist didn't even identify that I had postpartum depression, and she's a therapist, licensed for over 30, because that's not her training. I can't tell someone else, hey, they have, what's a treatment I don't treat. I work with parents and ADHD. That's not my specialty. I don't specialize in ADHD.
We could talk about that, because sometimes I feel like I have. But
a lot of moms
I gotta talk to another one.
Yeah.
But that's how it works.
Yes.
Not everybody's trained.
Yes, exactly. It's like asking a mechanic to go work on painting a car when the mechanic, their job is to
but
look
it's
at the
good
inside.
to know, because we're already not feeling well.
Yes.
And we're gonna sit there. Okay, I'm gonna do my due diligence.
Yes.
I'm gonna look up a therapist. It's important to look up the right one, because a therapist might say, yeah, come, I'll take your money and I'll also talk to you and try honestly to help you. But why waste your time? Go directly to the source, go directly to the person that has the correct training. So make sure you look for one that has that specific training to help you best.
Thank you.
Yeah.
Yes.
So
Definitely.
thank you so much
Thank you for having me.
for joining us.
Yes.
This is definitely a conversation that is a reminder of how important maternal mental health is. And it's not a luxury. Those of you that are enjoying healthy maternal health, make sure you stay on top of it. And if you have your next child, pre-game, prep, do that postpartum birth plan, talk to your spouse about a keyword, checkpoints to help you maintain that mental health so that you are successful in your postpartum journey. It's an absolute necessity. To all the moms listening, Sowania mentioned, you are not alone. You're doing great. Just breathe and just do your research to make sure you find the help that you need. What you're feeling is very valid, and there's always the help. You just have to look for it. If this episode resonated with you, please share it with a friend or partner or another mama that needs to hear it. Let's break this stigma and building stronger villages for each other that every mother deserves. So until next time, take care of yourselves, take care of each other. You're doing great.
Thank you.